Welcome to On Call with Dr. Anselm Anyoha. As infants grow, parents naturally look for signs that their child is developing as expected. Early milestones like smiling in response to a parent's face or saying mama or dada are wonderful achievements in a baby's first year of life. But few moments are as dramatic or as joyfully celebrated as when a child takes their very first steps. Walking is one of the most anticipated milestones in early childhood. Parents eagerly wait for that magical moment when their baby lets go, stands tall, and steps forward, sometimes wobbling, sometimes falling, but always moving toward independence. So, what happens when walking doesn't happen on schedule? Recently, I saw a 15-month-old who was not yet walking. His mother, clearly worried, described him as lazy. That single word sparked today's conversation. In today's episode, we'll talk about what's typical when it comes to walking, when a delay may be a reason for concern, and, most importantly, how families can support their child's unique journey toward mobility and independence. So, let's take those first steps together.
Dr. Anyoha, one of the most common questions parents ask is, when should my baby start walking? Some parents are counting the days, while others are worried because their child's peers are already on the move. So, when do most children typically begin walking?
That's a great question, and it's one I hear all the time in the clinic. Most infants begin walking independently around their first birthday, about 12 months of age. However, there's a very wide range of what we consider normal. Some babies take their first steps as early as 8 or 9 months, while others may not start walking until 13 or 14 months, and they are still completely healthy. When we adjust for prematurity, especially in babies born early, walking may happen a little later. For example, it can be perfectly normal for a premature infant to begin walking closer to 14 or even 15 months when we account for their adjusted age. Typically, babies move through several stages before walking. Most learn to sit without support by around 7 or 8 months. Crawling often follows around 9 or 10 months. Although not all babies crawl, many then begin pulling to stand and cruising along furniture between 10 and 11 months. Walking independently usually comes after that, around 12 months or shortly thereafter. It's also important for parents to know that babies don't follow the same script. Some are eager movers and start walking very early, even as young as 7 or 8 months. Others take their time. Some skip crawling altogether and move straight from sitting to standing and walking. The key message for parents is this: variation is normal. Walking is not a race. What matters most is steady progress over time, not hitting a specific birthday with a specific skill.
So, Dr. Anyoha, if a child isn't walking by 15 months, should parents be concerned? This is a question that really worries families.
That's an important question, and the short answer is yes. This is a point where we should pay closer attention, but not panic. Around 14 months of age, I start to watch more carefully. By 15 months, if a child has not taken independent steps, it's appropriate for a healthcare provider to evaluate what might be holding that child back. This doesn't automatically mean something is wrong, but it does mean we shouldn't ignore it. First, we always consider whether the child was born prematurely. Babies who are born early often reach milestones later when we adjust for their corrected age, and that can be completely normal. Next, we look at opportunities and practice. Walking is a skill that improves with use. A child who doesn't have enough space to move, who is always carried, or who hasn't had many chances to practice standing and stepping, may walk later than expected. In these cases, encouraging safe floor time and movement can make a real difference. That said, delayed walking can sometimes be a sign of an underlying issue: poor nutrition, including conditions like rickets caused by vitamin D deficiency, can delay walking. Vision problems, muscle weakness, bone abnormalities, or issues involving the brain and nervous system can also affect a child's ability to walk. Walking requires coordination between the brain, eyes, muscles, bones, and balance. When one part is not working well, the whole process can slow down. The good news is that early recognition allows us to help. When we identify concerns early, healthcare providers can intervene and refer children to supportive services. Physical therapy and occupational therapy are often very effective in helping children build strength, balance, and confidence. In some cases, supportive devices or targeted exercises may be recommended. The key message for parents is this: noticing a delay early gives your child the best chance to catch up and thrive. Asking questions and seeking guidance is not overreacting. It's good parenting. Parents play a huge role. Walking doesn't just happen overnight. It's a skill that develops through practice, encouragement, and opportunity. Babies learn to walk by using their bodies repeatedly. If a child is constantly carried or spends most of their time in seats, swings, or carriers, they may miss important opportunities to strengthen their legs, improve balance, and build confidence. Movement is practice, and practice is how walking is learned. Parents can help by giving their child safe opportunities to move. This includes allowing them to spend time on the floor, encouraging them to pull to stand, and letting them cruise along furniture. Around 9 months of age, or whenever a child begins to show interest in standing, parents can gently support these efforts. Holding a child's hands, offering sturdy furniture to hold onto, or using push-type walkers can all be helpful when used safely and under supervision. Just as important are patience and encouragement. Every child learns at their own pace. Some children need many attempts, many falls, and many tries before they feel confident enough to let go. Gentle reassurance, clapping, smiles, and calm support go a long way in helping a child feel secure enough to try again. In short, parents don't need to force walking, but by creating opportunities, allowing practice, and offering loving encouragement, they become active partners in their child's journey toward walking and independence.
Can some children skip milestones, like crawling, and go straight to walking? Parents often worry that something is wrong if their child never crawled.
Yes, absolutely. Child development doesn't always follow a straight line, and milestones don't have to happen in a fixed order. Some children move directly from sitting to standing and then to walking, skipping, crawling, or even cruising along furniture altogether, and that can be perfectly normal. Crawling is a common and helpful stage, but it's not a requirement for walking. What matters most is that the child continues to make progress toward independent mobility. If a child can sit without support, pull to stand, bear weight on their legs, and eventually walk independently, the path they took to get there is less important. Children are individuals. Some prefer rolling, some scoot on their bottoms, some crawl backward before moving forward, and some simply stand up one day and take off. As long as they are gaining strength, balance, and coordination, skipping a milestone doesn't automatically signal a problem. The key takeaway for parents is this: focus on forward progress, not checking off every milestone on a list. If your child is moving, exploring, and becoming more independent over time, they are doing exactly what they need to do.
What kinds of medical conditions can delay a child's ability to walk? This is often where parents' fears really begin.
There are several medical conditions that can delay walking, and it's important to remember that many of them are identifiable and manageable, especially when caught early. Anything that affects the brain, nerves, muscles, bones, joints, or vision can interfere with walking. Walking requires coordination, strength, balance, and the ability to see and respond to the environment. So if one part of that system isn't working as well as it should, walking may be delayed. Neurological conditions, such as seizure disorders or cerebral palsy, can affect muscle control and coordination. Muscle weakness or low muscle tone can make it harder for a child to stand and move confidently. Problems with the hips, legs, or joints may also limit movement or cause discomfort. Vision impairments can delay walking as well, since children rely heavily on sight for balance and spatial awareness. Certain genetic or developmental syndromes may also affect motor development, including walking. In addition, prematurity is a very common and important factor. Babies who are born early often reach milestones later, and we adjust our expectations based on their corrected age. For example, a baby born 2 months early may walk closer to 14 months rather than 12 months, and that can still be completely normal. The key message for parents is this: a delay doesn't automatically mean a serious diagnosis. It means the child deserves a thoughtful evaluation. Identifying the cause allows healthcare providers to guide families toward the right support, therapies, and resources, helping each child reach their full potential.
How do you evaluate a child who isn't walking by 15 months? What does that process usually look like for families?
The evaluation is thoughtful, step by step, and usually very reassuring. The first thing I do is take a detailed history. I ask questions such as, was the child born prematurely? Has the child met other developmental milestones, like sitting, crawling, or standing? Are there any concerns about speech, vision, or social development? I also ask about nutrition, medical history, and what the child's daily routine looks like at home. Next, I will perform a careful physical examination. I look at muscle tone and strength, check reflexes, observe posture and coordination, and watch how the child moves, whether they bear weight, pull to stand, or cruise along furniture. Often, simply observing how a child plays provides valuable clues. If needed, I refer the child to physical or occupational therapy. These specialists are excellent at helping children build muscle strength, improve balance, and gain confidence through guided play and movement. Many children make significant progress with therapy alone. In some cases, if concerns remain or red flags are identified, further investigations may be recommended to rule out underlying medical conditions. This might include imaging or laboratory tests, but these are not always necessary. The most important message for parents is this: evaluation is not about labeling a child. It's about understanding how best to support them. Early assessment allows us to intervene early, and early intervention gives children the best opportunity to thrive.
Why is walking such an important milestone, beyond just getting from one place to another? Why does it matter so much in a child's overall development?
Walking does far more than help a child move. It dramatically expands their world. Once a child can walk, they gain a new level of independence. They no longer rely entirely on being carried from place to place. Instead, they explore on their own terms. They choose where to go, what to touch, what to examine, and what to avoid. That freedom changes how they learn. Walking fuels cognitive development because children learn by exploring. As they move through their environment, they touch, feel, compare, and experiment with objects. They begin to understand space, distance, cause and effect, and problem solving in a very real, physical way. It also supports language and social development. A walking child interacts more with people and objects, brings items to caregivers, points, gestures, and communicates through movement. These experiences create opportunities for naming objects, asking for help, expressing preferences, and engaging socially. Movement becomes a form of communication. In essence, walking is a gateway milestone. It opens the door to broader learning, stronger social interaction, and greater independence. That's why we pay close attention to it, not just because of the steps themselves, but because of everything those steps make possible.
What advice do you give to parents whose child isn't walking yet and are starting to feel worried or discouraged?
The first thing I tell parents is this: stay calm and stay engaged. Walking develops through practice, and parents can play a very positive role in encouraging it. Give your child plenty of safe time on the floor. Let them move, explore, pull to stand, and practice balancing. Support them gently as they stand or take steps, but try not to carry them constantly, as that limits opportunities to build strength and confidence. Using sturdy push toys or walkers that a child can hold onto and move forward can be very helpful when used safely and under supervision. Encouragement matters. Celebrate attempts, not just success. Falling is part of learning, and children gain confidence when parents respond with reassurance rather than anxiety. If a child is not making progress by 15 months, it's important to talk with your pediatrician or healthcare provider. An early evaluation can identify whether extra support is needed. When appropriate, early referral to physical or occupational therapy can make a big difference, often helping children catch up more quickly than parents expect. And most importantly, don't panic. Many children who walk later than their peers catch up beautifully once they are given the right opportunities and support. Your job is not to rush your child, but to guide them, encourage them, and advocate for them when needed.
Can delayed walking affect other areas of a child's development, or is it mostly just about mobility?
Yes, delayed walking can influence other areas of development, though the effects are often subtle and reversible, especially when addressed early. Mobility plays a powerful role in how children learn and interact with the world. When a child can move independently, they have more opportunities to explore their environment, interact with objects, and engage with people. This exploration fuels cognitive development, including problem-solving, attention, and learning through experience. Walking also supports language and social growth. A mobile child is more likely to approach caregivers, bring objects to share, point, gesture, and communicate wants and needs through both movement and words. When walking is delayed, some of these experiences may happen later as well. That's why timely support matters. Helping a child develop walking skills isn't just about getting them on their feet. It's about opening doors to broader learning, communication, and social interaction. When we support mobility early, we support the whole child. The reassuring message for parents is this: with the right encouragement and, when needed, early intervention, children often make rapid gains, not only in walking, but across multiple areas of development.
What's your final message to parents when it comes to walking milestones?
Walking is a joyful and exciting milestone, but it's important to remember that every child develops on their own timeline. Most children begin walking around 12 months of age, some a little earlier and some a little later, and that range is completely normal. By about 15 months, if a child has not yet started walking, it's wise to seek an evaluation, not out of fear, but out of care. Early attention helps us understand what a child needs and how best to support them. Parents play a vital role in this process. Encourage practice, provide safe opportunities for movement, and avoid carrying your child most of the time. Let them explore, pull up, cruise, and try, even if they wobble or fall. Those attempts are how confidence and strength are built. And remember, support is available. When needed, therapies such as physical or occupational therapy can make a meaningful difference. With encouragement, opportunity, and the right support, most children go on to thrive and reach their milestones successfully. Thank you for joining me on Call with Dr. Anselm Anyoha. If you find this episode helpful, please share it with friends and families, especially parents watching their little ones take those first steps. Until next time, stay informed, stay compassionate, and celebrate every milestone, big or small.